I'm going to walk you through what we're going to do here. This is a patient who has some fullness in the back part of the knee, what we call the popliteal fossa, and in fact we found a Baker cyst. You can see, we kind of zoom in on the ultrasound machine. If you want to come up here a little bit closer, this is the Baker cyst, and it's fluid. So when I push down, it compresses, and you can see this little tail on the Baker cyst. So there's a valve down here, and when the knee fills with fluid, it tracks out here and forms this water balloon essentially, and it sits between the medial head of the gastrocnemius muscle and the semimembranosus tendon, which is one of the hamstring tendons. So the reason I mention that is there's all this fluid around these muscles and tendons, and so it can cause some dysfunction, it can cause some fullness, it can cause an inability to fully bend the knee. So we're going to very simply remove this fluid with help of the ultrasound. So what I'm going to do first is properly localize it, and then I'm going to clean the patient. And this will be a pretty quick and easy process that we can obviously do in the office here. Now, she's had the knee treated in the past by another provider, but they didn't have access to an ultrasound, or maybe just don't use ultrasound technology, and so they didn't visualize this Baker cyst. But in fact, it can be intrusive for people, and so it's often helpful to remove the fluid. So after she's cleaned up, I'm going to use a little bit of buffered lidocaine to numb the area. So a real tiny needle here. You might feel a little poke. Okay, good. Now I'm going to administer the lidocaine, just about a cc or 2. I'm going to create a little bubble under the skin. It might burn a little bit just for a couple seconds. That'll go away. This is going to numb the skin for the second part, which is the aspiration needle. So here we go. Doing okay?
Okay.
All right. Putting a nice amount of lidocaine in there. Now, you'll see the second part, you'll see the needle actually advance into that Baker cyst. So we're going to finish with the numbing. All done there. Now, wait just a couple seconds to let that fully set in, and then I'm going to use this little bit larger needle that she really shouldn't feel much of because she's pretty good and numb. We're going to advance this into the cyst space. Okay, good. Now poke. Great. Okay, there. You can actually see, if you look at the ultrasound, you can see the needle in the cyst. So there it is, kind of dancing around right in the middle. And then if you pan back maybe to the actual syringe, you'll see as I start to withdraw, that fluid comes out, and it's the typical yellow color of joint fluid, of synovial fluid. So that's very normal. It's just an overflow. There's too much fluid on the knee. And if you go back to the ultrasound, you can actually see it kind of decompressing that water balloon, making it smaller and smaller and smaller. And then eventually we will get all of it out. We're almost there. And that's pretty good. So I'm going to go ahead and remove the syringe now. Pretty much topped that guy out. There we go. How was that? Not too bad?
Not too bad. Didn't feel a thing.
Didn't feel a thing. Okay, cool. So there were about 12 cc's of fluid in that Baker cyst, and she's going to be feeling a lot better after this.